The physiology of respiration refers to the process by which the body exchanges gases, oxygen O2 and carbon dioxide CO2, to maintain homeostasis. This is a crucial concept in nursing, as proper respiratory function is essential for life and often needs close monitoring and support in clinical settings. Here is a step-by-step breakdown of the respiration process, along with its applied relevance to nursing practice. Step-by-step process of respiration. 1. Pulmonary ventilation, breathing. Definition: the physical movement of air into and out of the lungs. Phases: inhalation, inspiration, diaphragm contracts and flattens, external intercostal muscles lift the rib cage. This increases thoracic volume and decreases intrathoracic pressure, drawing air into the lungs. Exhalation, expiration, diaphragm relaxes and moves upward. Intercostal muscles relax, reducing thoracic volume and increasing pressure to push air out. Nursing application: monitoring respiratory rate, depth, and pattern, supporting patients on ventilators or with compromised breathing. 2. External respiration, gas exchange in the lungs. Location: alveoli of the lungs. Mechanism: O2 diffuses from alveolar air, higher partial pressure, into pulmonary capillary blood, lower partial pressure. CO2 diffuses from blood, higher pressure, into alveoli to be exhaled. Nursing application: assessing oxygenation using pulse oximetry or ABGs, managing oxygen therapy. 3. Gas transport in the blood. Oxygen transport: 98% bound to hemoglobin as oxyhemoglobin, 2% dissolved in plasma. Carbon dioxide transport: 70% as bicarbonate HCO3 mass, 23% bound to hemoglobin as carbaminohemoglobin, 7% dissolved in plasma. Nursing application: understanding ABG interpretation, managing acid-base imbalances, recognizing signs of hypoxia or hypercapnia. 4. Internal respiration, gas exchange in the tissues. O2 moves from capillary blood to tissue cells, higher to lower concentration. CO2 moves from tissue cells into blood for removal. Nursing application: recognizing impaired perfusion or hypoxia at the cellular level, especially in conditions like shock or sepsis. 5. Cellular respiration, use of O2 by cells. Definition: the metabolic process where cells use oxygen to produce ATP, energy, and generate CO2 as a byproduct. Equation: C8H10O plus 6O2, 6CO2 plus 6H2O plus ATP. Nursing application: understanding energy needs in healing, sepsis, fever, and monitoring for metabolic derangements in critically ill patients. Applied physiology for nursing practice. Monitor respiratory function, respiratory rate, depth, and rhythm, use of accessory muscles, cyanosis, clubbing, altered mental status, oxygen therapy, administering O2 via nasal cannula, mask, or mechanical ventilation, preventing O2 toxicity and monitoring saturation, acid-base balance, interpreting arterial blood gases ABGs, managing conditions like respiratory acidosis, alkalosis, patient education, teaching effective breathing techniques, e.g. diaphragmatic, pursed lip, encouraging pulmonary hygiene, e.g. coughing, incentive spirometry. Emergency response: recognizing and responding to respiratory distress or arrest, implementing CPR and airway management. Thank you. Have a nice day.